Hello and welcome to the Guide Online Educational Library. The topic we will preview for you at this point is the All-on-4 concept with regard to immediate loading. And what this particular section will involve is the conversion process and how I recommend that perhaps the best and most efficient way to pick up all of the cylinders on all of the implants that have just been placed and convert an immediate denture into a provisional fixed restoration. We'll talk about the various stages of converting from the initial examination, which will involve photographic and radiographic and clinical evaluation of the patient in a setting that allows us to prepare before surgery basically a set of immediate dentures and how we can modify those immediate dentures to enhance the process of utilizing resin through holes in the denture base to pick up and index cylinders against the prosthesis itself. There are a number of different steps. There's a number of different series of preparatory procedures involving both using a disclosing medium such as blue mousse to identify the position of the implants by utilizing a drilling sequence and 4 specific drills that will allow you to modify the denture and create holes in it that allow the cylinders and the guide pins to be indexed into the denture without interference against the hard resin, utilizing a technique of simply injecting material into both the anterior and then subsequently the posterior sites, and creating in the mandibular arch a vertical dimension of occlusion that is correct for the patient's original presentation by simply having the patient bite into the prosthesis as it is indexed against the maxillary arch and then reduced to the point where the vertical dimension is replicated from the patient's preoperative state. The prostheses are essentially completed in the same day, or they can be completed within 24 to 36 hours. It really doesn't matter from a time perspective. But if you have a lab that allows you to do this in a single day, these final restorations can end up looking something like this: delivered, fixed, in position, on provisional cylinders, splinted together with all the implants, and allow a healing process to occur that has been documented to be very effective in allowing the implants to heal in a relatively normal manner. This is what this particular section of the Guide Educational Library will show. Thank you very much.
For more education programs, visit the Guide Institute at www.guidedental.com.